Savannah Pfeiffer, Alana Molino, and Christina Jones became friends at a Kaiser intensive outpatient program. All three say the strike has made it harder to access mental health care.
It's hard enough trying to even admit that you need therapy or you need antidepressants on a regular basis. It's hard to admit that to yourself. It's hard to admit it to someone else. And it's hard to go through the trauma with a therapist, a stranger, in order to get that.
Alana Molino is a history teacher. She says it's difficult restarting therapy with temporary providers.
And because they're on strike, we're seeing different therapists. And you have to start pretty much from scratch with a new therapist and uncover all of the trauma again that you've just worked out with someone else.
As a school mental health caseworker, Savannah Pfeiffer empathizes with the strikers.
But at the same time, it's like, what about us? Like, we got forgotten and left, hung out to dry, basically.
Pfeiffer says before the strike, it took about 3 weeks to get an appointment, but now it's longer.
4 months for a psychiatry appointment is not okay. And the psychiatrists aren't even on strike. So
A Kaiser spokesperson disputes the 4-month wait. They say they've scheduled more than 235,000 appointments for members since October 21st. The state requires HMOs to provide a non-urgent mental health appointment within 10 days of the request. But Pfeiffer says she's filed 2 complaints since the strike began.
just trying to get adequate care and get, treated like a human being and get seen in a timely manner and have some continuity of care. But
Christina Jones is a community organizer. She says it was tough when the social workers running the outpatient program were replaced.
But when they left, the type of care that we received after, it was so subpar and raggedy.
Kaiser says temporary staff are qualified providers, but the union argues they might not have specialized training. Kaiser also says crisis clinicians are available 24/7 to all patients with urgent cases. But Jones had a negative experience.
I let the person know I was having an emergency, and they were like, "You don't sound like you are, though." And so I was like, "Oh, girl." Hold on. I was like, so it's this whole performance and telling your story to stranger after stranger in this system that says that it cares.
Despite the challenges, the 3 women say they found support in each other.
yeah, it's like a glimmer of light in this darkness, because there are other people who have mental health issues and we aren't the only ones.
As the strike continues, they're looking at other health insurance options, including paying for therapy out of pocket. In the interest of disclosure, Kaiser Permanente is a KPBS underwriter. Heidi de Marco, KPBS News.